Thank you, Chairwoman Eshu. Let me start out by saying we are continuing with this committee's work today of putting consumers first, expanding access to health care, and making both prescription drugs and health care more affordable. And the 10 bipartisan bills we're marking up today will take a great deal of strides towards achieving those goals. I want to thank, first of all, I do want to thank Ms. Eshu, our chairwoman, Dr. Burgess, the ranking member, and all the staff for working so hard to make this markup possible, in a bipartisan fashion. And of course, I want to thank our ranking member, Walden, for all his work on many of the bills, particularly the surprise billing. I should mention also, Madam Chair, that, it's not only our committee, it's also the fact that, for the most part, these bills have Senate counterparts, and we've been working on a bipartisan basis with the Senate as well, and with the President. So I think, for the most part, these bills are likely to become law. These are not message documents today. This is the real thing that is worked on with the Senate and with the White House, and I think most of the things that you see here today will ultimately become law. And so that's significant. It shows the bipartisan nature of the committee and also the bicameral nature of what we're doing. The process has always been to keep the patient and the consumer at the center, and so I'm also proud of that. I wanted to mention, Madam Chair, also that Jeff Carroll's daughter Lizzie is here today at the desk. She's helping us, sort of a day intern. I think everyone would recognize the resemblance. I don't have to mention that. We've said that before. So what have we done? We've negotiated a 4-year extension of our expiring public health programs. We've tackled the difficult problem of surprise billing, and we've also reached a long-term funding agreement for the Medicaid programs for Puerto Rico and the U.S. territories. Not permanent, we're still working on that, but from 4 to 6 years, which is the longest I think that we've ever had in terms of any kind of extension for those Medicaid programs for Puerto Rico and the territories. Today we'll consider the No Surprises Act, which I introduced with Ranking Member Walden to address the issue of surprise medical billing. Our legislation removes the surprise from billing by completely protecting patients in emergency situations, patients who did not specifically choose to see an out-of-network physician for scheduled care, and patients in situations where there is no in-network provider available to treat them. This legislation protects consumers, and it does it without raising health care costs for working Americans. It's critical that we pass this legislation today and finally protect patients from these outrageous surprise medical bills. The subcommittee will also mark a number of bills to improve the Medicare program and reauthorize vital public health programs that strengthen the healthcare workforce and provide direct access to health care for American families. The Title VIII Nursing Workforce Reauthorization Act, introduced by Representative Joyce, and the Empower for Health Act, introduced by Representative Schakowsky, will ensure that our nurses, doctors, and allied health professionals receive the training and support they need to be the strong, stable, and diverse workforce. The subcommittee will also strengthen a number of public health programs that will expire at the end of this fiscal year. Representative O'Halloran's Community Health Innovation, Modernization, and Excellence Act will provide community health centers and the National Health Service Corps with a historic level of funding. And this bill will extend the programs for the longest period since the Community Health Center Fund was created in the Affordable Care Act. We'll also consider an amendment in the nature of a substitute to the package offered by Representative Butterfield that will incorporate long-term extensions of several other health programs, including the Teaching Health Center Graduate Medical Education Program. We've also acted decisively to address the dire humanitarian crisis looming in the territories. Today, we'll consider a bipartisan bill that will provide 4 years of additional funds and an enhanced matching rate to Puerto Rico, and 6 years of additional funds and enhanced matching rates to the U.S. Virgin Islands, American Samoa, the Northern Marianas. We'll also consider an amendment that will provide 2 years of responsible relief to the pending reductions to the Disproportionate Share Hospital Payments, or DSH, and we're also considering the Fair Drug Pricing Act, as well as an amendment in the nature of a substitute with other provisions that will increase drug pricing transparency. This legislation will ensure consumers have access to more information about how prescription drugs are priced and why drug prices are increasing. So again, all 10 of these bipartisan bills are good. I look forward to sending them to full committee, markup next week. And again, I want to thank you, Madam Chair, for your leadership and your continued commitment to moving these bills through the subcommittee and all that you've done. Thank you, Madam Chair.